हाय गाइस, वेलकम टू द मेडिसिन मेड। आज हमारा टॉपिक है मीडियास्टिनम। सो मीडियास्टिनम इज द मिडल स्पेस इन द thoracic cavity between the two lungs, and the mediastinum is divided into the superior mediastinum and the inferior mediastinum, है ना। So superior mediastinum क्या है कि it is placed in between the mandibular sterna and the posterior there is a vertebra. So today we are going to see the contents as well as boundaries of the superior mediastinum and inferior mediastinum. But the inferior mediastinum is divided into the three parts, that is anterior mediastinum, medial mediastinum and the posterior mediastinum, है ना। So we are going to see the superior mediastinum. So आप देख सकते हैं कि mediastinum is divided into the superior mediastinum and inferior mediastinum. inferior mediastinum के और से पार्ट होते हैं कौन कौन से? anterior mediastinum, medial mediastinum and the posterior mediastinum. So now we are going to see the superior mediastinum. So boundaries of superior mediastinum कौन कौन से? हम इस डायग्राम में देख चुके हैं कि बाउंड्रीज कौन कौन से. Anterior there is a mandibular sterni, posterior there is a vertebral column that is from the T1 to the T4, and superior there is a thoracic inlet, and inferiorly there is a imaginary line passing between the contents of the superior mediastinum. अभी हम देखेंगे इंपॉर्टेंट कंटेंट कौन कौन से. सो इंपॉर्टेंट कंटेंट्स ऑफ द सुपीरियर mediastinum आर द ट्राकिया एंड esophagus as well as muscles and the some thoracic duct and the some lymph nodes. So important content में आता है कि trachea, esophagus and the muscles as well as some thoracic duct. So muscles are the sternohyoid and the sternothyroid. आपको समझना चाहिए कि द मसल्स आर ओनली प्रेजेंट इन द सुपीरियर mediastinum, नॉट द inferior mediastinum. सो आप कौन से भी मसल लिखने हैं तो आपको अंदाज रहना चाहिए कि मसल्स आर ओनली प्रेजेंट इन द सुपीरियर mediastinum. So the arteries are the arch of aorta and the brachiocephalic artery as well as arch of aorta की branches कौन कौन सी होती है? brachiocephalic artery, left common carotid artery and left subclavian artery. veins कौन कौन से? right and left brachiocephalic veins. superior vena के वहाँ nerves हैं vagus, phrenic, left recurrent laryngeal nerve as well as thymus and the thoracic duct as well as lymph node. आप देख रहे हैं कि यहाँ पे मैंने देखने की कोशिश की है कि कंटेंट कौन कौन से. सो जो आपको वेन दिख रही है वो है सुपीरियर वेना केवा. सो दिस वन इज द सुपीरियर वेना केवा एंड दिस वन इज द राइट ब्रेकियोसेफेलिक वेन, राइट ब्रेकियोसेफेलिक वेन, है ना. सो राइट ब्रेकियोसेफेलिक वेन and the left brachiocephalic vein. This one goes to the left brachiocephalic vein, है ना. So this one is the arch of aorta. arch of aorta के 3 branches कौन कौन से हैं आपको पता होगा. This is brachiocephalic artery, this one the left common carotid artery and this is left subclavian artery, है ना. So this one is the trachea, this one is the trachea, this one is the esophagus. So these are the contents of the superior mediastinum. इसमें important nerves भी है. और कौन कौन से nerves है? This nerve is the phrenic nerve and this one is the vagus nerve and this one is the phrenic nerve, है ना. So these are the contents of the superior mediastinum. Now we are going to see the inferior mediastinum. So inferior mediastinum is divided into anterior mediastinum, medial mediastinum and the posterior mediastinum. So boundaries mediastinum के anterior there is a body of sternum, posterior there is a pericardium, superior there is imaginary line obviously, and the inferiorly the superior surface of the diaphragm. As well as on each side there is a mediastinal flora. आपको ध्यान में रखना चाहिए कि in the superior mediastinum as well as inferior mediastinum on each side there is always presence of the mediastinal flora. So the contents of the anterior mediastinum are not so important, but here we are giving those content, that is the sternopericardial ligaments, the ligaments which join between the sternum and the pericardium, lymph nodes and lymphatics and lowest part of the thymus obviously, and some areolar tissues, है ना. So these are the contents and the boundaries of the anterior mediastinum. Now we are going to see the medial mediastinum. So medial mediastinum is very important because its main content is the heart and its pericardium. So boundaries, anteriorly there is obviously sternopericardial ligaments coming from the sternum. Posteriorly there is posteriorly there is esophagus, which is present in the superior mediastinum. There is a descending thoracic aorta and the azygous vein. These are the posteriorly these organs or these vessels are present in the medial mediastinum. So now we are going to see the contents of the medial mediastinum. The contents of mediastinum contains heart and its pericardium. Second, heart and its pericardium, and there is a nerve, phrenic nerve, which is also present in the superior mediastinum. And the important part is in the medial mediastinum there is a bifurcation of trachea occurs. There is a bifurcation of the trachea occurs, so it forms the right and left principal bronchi, है ना. So आर्टरीज कौन सी है? तो असेंडिंग एरोटा, पल्मोनरी ट्रंक, टू पल्मोनरी आर्टरीज आपको you have to understand this. Veins, superior vena cava, azygous vein, and right and left pulmonary veins. So these are the contents of the medial mediastinum. Now we are going to see the posterior mediastinum. So the posterior mediastinum is present behind the medial mediastinum. So the anteriorly there is a pericardium obviously of the covering the heart, and there is a bifurcation of the trachea. In the mediastinum there occurs the bifurcation of the trachea and some pulmonary vessels, है ना. So posteriorly there is a lower 8 thoracic vertebra. Posteriorly there are lower 8 thoracic vertebra. As we can see in this diagram, in the posterior mediastinum there are lower 8 thoracic vertebra from the T4 to the T12. So these are the posterior boundary of the posterior mediastinum, है ना, and some intervening disc between the vertebrae. So the contents of the posterior mediastinum are the esophagus. So we have to remember that the esophagus is only present in the superior mediastinum and the posterior mediastinum. Arteries are the descending thoracic aorta and its branches. And the next important content of the posterior mediastinum is thoracic duct. सो आपको जब एग्जाम में लिखना होगा, सो इम्पोर्टेंट कंटेंट्स है तो आपको लिखना ही होगा, आपको याद रखने हैं. So these are the important contents of the posterior mediastinum, as well as you can write the azygous veins, hemiazygous veins, and accessory hemiazygous veins. Nerves are vaginal nerves and splanchnic nerves. ठीक है. So these are the contents of the posterior mediastinum, anterior mediastinum, medial mediastinum, and the superior mediastinum. So in the exam you have to write applied anatomy as well. So in the applied anatomy you can write a mediastinitis, that is inflammation of the mediastinum. It occurs from the neck, है ना. So there is one important syndrome, that is the mediastinal syndrome. So mediastinum क्या है? Mediastinal syndrome क्या है? Mediastinal syndrome is a compression of mediastinal structures by any tuber giving rise to group of symptoms, that is the mediastinal syndrome. So the mediastinal syndrome is the group of the symptoms. So इसमें group of symptoms में क्या क्या आता है? अब symptoms in the mediastinal syndrome includes obstruction of superior vena cava, give rise to the engorgement of the veins in the upper half of the body. Pressure over the trachea causes dyspnea and cough. Pressure on the esophagus causes dysphagia, है ना. So the pressure on the phrenic nerve causes paralysis of the diaphragm on that side. So mediastinal syndrome is a group of the symptoms. The common causes of mediastinal syndrome are the bronchogenic carcinoma. One is the bronchogenic carcinoma. Second one is the Hodgkin's disease. And the third one is the enlargement of mediastinal lymph node, that is as well as includes aneurysm and dilatation of the aorta. So these are the clinical anatomy. We can also include a tumor in the dead space. So this is the clinical anatomy of the mediastinum. So for the exam you have to draw the diagrams, 2 to 3 diagrams, write their boundaries, contents, and the parts in which the mediastinum is divided. You will definitely get good marks. Thanks for watching this video. Please like, subscribe, and share. Thank you.